Today, we're just going to see a bunch of calluses. I decided to do something a little bit different and just video all the calluses that I do in any given week. And this is not even all the calluses. Some patients said they'd prefer I didn't video, but and some just didn't have calluses, and some weren't there for nails and corns and calluses. They were there for something else. So there's a bunch of different patients and a bunch of different types of corns and calluses. So I hope that you enjoy our video today. So if this one's not hurting, then we'll just see between your pedicures and me if we can keep it from hurting. Okay?
I didn't even know it's there, except that Andy says, oh yeah, it's getting bigger there. So.
Yeah, and it just has to do with how your foot is rubbing against the shoe or hitting the ground, or so. All right. So things have been good?
Yeah, everything's fine.
No changes in medication?
I'm ready for spring. Last snowstorm was enough.
Nature has a way of doing that, doesn't she?
Yeah, so, I was watching Twin Cities Live the other night, and they were saying, and I was thinking about it, I think they're right. We tend to get one last blast of a snowstorm either in March or April, and it seems like if we get it in March, we don't get it in April, and vice versa. So hopefully we're done, maybe, huh?
But it's always at the high school boys basketball championship.
Yeah, you know what? Yeah, one of the nurses I used to work with who had 3 sons who were in various sports, and she always said that was always a struggle, getting around, because her boys were either in hockey or basketball.
Yeah, and all those finals are about right now.
Yeah, so we'll see.
We'll see.
It was kind of nice that it landed on the weekend, so
Yeah.
people didn't have to be struggling getting to and from work.
Yes, that was lucky.
I remember those days. Oh my gosh, I drove on some pretty terrible roads. No highway patrol, no nothing.
Can't see the lines. Make it up as you go.
Not even plowed. You know, they didn't plow. I worked afternoon, so I was driving at midnight, and they didn't plow till 5 a.m. So it was just me and the road. It was really scary. Fortunately, there were.
There's always a little edge around these. Smooth. Okay. All right. So that looks good. Go ahead and feel this one and tell me if that feels like it's enough.
Yeah, I don't want you to do too much.
Okay.
And then I'll be wearing my orthotics. I'll wear them more. And then is that one okay?
Yeah, there's like nothing there.
Okay.
And he normally comes every 60 or 90 days?
I'll have to look at the
Okay.
chart and see. I think it's every 60.
60, okay.
Надо будет, чтобы она мне смазала,
Huh?
чтобы помазала.
Oh, okay.
Вазелином или чем.
Right, so he wants a lotion to put on it.
Of course, конечно.
Да.
И бендage наклеить.
Что еще? On the
Bandage.
band-aid, and the band-aid over the callus thing.
You have bandage?
Okay. Конечно.
О, вы хорошо говорите по-русски.
No.
Yeah.
10 слова. И одна шутка.
But you understand, I mean, well...
Well, I understood what he was
Right.
asking, yeah.
Okay.
Just the context. Yes. Понимаю чуть-чуть.
Ну, если бы я вот так по-английски говорил бы, о,
Well, between your English and my Russian, we could get it figured out.
я только могу пару слов в конце сказать,
Mhm.
что вы очень хороший врач.
Oh, did you get it?
No, sorry, I wasn't listening.
Oh, okay. So, скажите по-английски скажите, Майк.
You very good. Как врач?
Doctor.
Doctor.
Доктор.
Спасибо.
И по-русски доктор.
Нет, по-русски.
You very good doctor. Excellent.
Я нужна переводчик. Всегда. Но спасибо.
So the most common word for doctor is врач.
Yeah, I know that
You know
one.
that, right?
Yeah, I knew that. I knew that word. Yeah, it's one of my 10 slova.
Mhm. I mean, both words, I mean, still.
Следующий раз.
Сейчас доктор посмотрит, когда в следующий раз. Через 2 месяца, наверное. Не знаю.
Через 2?
Ну,
А
наверное.
ты же говорил в апреле.
А что, есть уже appointment в апреле?
Нет.
Во-во.
Нету.
Yeah, I'll look at the chart before you go. Yeah.
Shower foot, it says in back scrubber, but
Yeah, you'd have to see if it's got like suction
with
cups.
wall-mounted suction cups,
All right, so you can suction it to the floor of the shower.
or you can otherwise you can suction it to the wall for your back. I suppose is the idea.
Yeah, but
Okay. but
really your back isn't an issue. It's
No.
between your toes here.
no, right.
So you can scrub your feet over that. Wow, I can't imagine walking on this little callus here. Would have
Well,
to-
you know, I have something to put in the bathtub so you can stand, so you don't slip, but
Right.
maybe it's,
Yeah, this is.
This is different.
Yeah.
This is so that you can clean in between your toes without having to pay somebody to do it for you.
Mhm.
Because there was a lot of toe jam in between some of those toes.
Yeah, I have, like I said, something to stand on so you don't slip.
Yeah.
That stuff builds up when you walk on them, I guess.
The callus?
Yeah.
Oh, yeah. You know, the good news is this gets thick because you're doing a lot of walking. When, you know, if you're ever in a wheelchair and not walking anymore, this isn't going to be a problem.
Or sometimes they put a cream on them or a lotion and then wear a sock to soften it.
Yeah, but it's not going to get rid of it. It's just
Yeah.
like when people soak a callus or corn, it'll make it softer while it's wet, but then when it dries, it gets just as hard and painful as it was before.
I guess the more you or whatever it is.
Yeah, the more you walk on it, the more it builds up. Exactly. So the good news is when you come in with a thick callus like this, it tells me that you're walking. Okay.
She is.
No, that's
Okay. Let's get these over here. These are not nearly as bad, not nearly as thick.
Does it help to put lotion on it and wear socks at night when you sleep or anything?
No, it really won't make a difference because the calluses form. I always tell people it's not a skin problem, it's a pressure problem.
Pressure, okay. when you
So
walk.
these spots on your toes are getting more pressure than they're meant to. And it's because the tips of your toes are kind of angled like that. So that when you're walking, you're getting pressure on the tip instead of on the pad. So, I mean, there is a very simple procedure we can do here in the office where I just release the tendon that's pulling that part down and see if we can bring it up enough to get rid of these calluses. But these ones aren't so bad. I wouldn't do it for these, but for the one on your left foot, we can talk about it. As long as you've
Like
got
a hammer toe thing?
less than that.
Less than.
Yeah, a hammer toe thing we would definitely have to go to a surgery center for
Yeah.
because that involves bone.
Yeah.
But for this, the incision is just the size of my scalpel blade.
Yeah.
And I numb up your toe, go in with my scalpel, release the tendon. And, you know, there's not a lot of aftercare for it. You just have to keep some Neosporin or bacitracin on it with a Band-Aid under here. And then stitches come out after about 10 days. And it's a nice alternative to going to the surgery center.
Yeah.
But as long as your circulation is good enough, there's, you know, your age is not a reason to not do it. Being on a blood thinner wouldn't make much of a difference with this.
You're getting a lot off there.
Yeah, stuff builds up.
Yeah.
You walk a lot, or
Yeah.
over time anyway.
Keep walking and keep coming in so I can trim these down for you. All right. Well, thank you for letting me do the video here of your calluses.
It's healed, and he's now in a,
It was a diabetic wound, right?
it was a diabetic wound that became, that he was seeing a doctor
Mm-hmm.
at one time who kept scraping it. Anyway, he had a blood infection. It was awful. It was really awful.
I do remember that now.
But he's in a custom boot that looks like it's an outer space boot.
Mm-hmm.
It
Right.
does. It looks like,
It just offloads every pressure point on the foot
well,
because they're custom
he's going to
made.
be in it for like, yeah, Winkley made it.
Mhm.
Winkley? Is that
Mm-hmm.
It looks like something that they'd wear in Star Trek.
Yeah, it's called a crow walker. It's a Charcot. I forget what
He
the
said
R
it's made
stands
out
for.
of plastic.
Yeah. Yeah. but it's molded directly to his foot to keep the pressure off the pressure points.
And that's good because he's going to work for a long time.
Yeah, I forget what the R stands for. It's Charcot restriction orthotic or something like that.
You know, he goes to Abbott, and he did ask the doctor. He was going to a bar mitzvah. He said, "Could I wear a shoe for 2 hours?" And she said, "Yes." But 2 hours wouldn't make that much damage. But now I hear about people that get dressed up and they just wear like tennis shoes. That's the new.
It's a
went
new
to
world.
A bar mitzvah at Doth on Saturday.
Mm-hmm.
The father was wearing tennis shoes, white ones. The boy was wearing tennis shoes. Everybody wears tennis shoes.
That's a little odd, I think.
I don't know.
That's just
I just
me.
always thought if you're wearing a suit, you just wear a pair of
Nice.
shoes.
You know, and there are so many men's shoes that look like nice casual or even wingtips
Right.
that fit like a walking
Yeah,
shoe.
they're like comfort shoes.
Scoot over this
Okay.
a little bit.
Are your glasses recording?
They are.
Are you, seriously?
Yeah.
Is there voice on?
Yeah, so it's
What else? What next? That's amazing.
it's not as good as the video camera because I can't zoom in and out, and
Is
I
it
can't.
a voice on it too?
Hmm.
Oh, then I won't talk.
Oh, you definitely can talk. I mean, if you want me to take off everything you just talked about, I can put music or something behind
No.
it.
I don't care. Just like when you go to the doctor and they ask if you care if like they use your whatever for medical research. I don't care. I don't need a nude picture of myself, but I'm sure they did that when I had my knees done.
You're sure they did what?
Used my picture of my knees because I had them both replaced at one time. I'm sure that went to science.
No, I've heard of people doing that before.
That was a good idea, I thought. So you having a good winter?
Well, except for, you know,
Did your cleaning people ever come back? We
they
talked
did.
about that
Yeah,
last time.
all
Mine did too.
all the people who were too afraid to leave their house have come back. I know
I
that
was
they're.
so happy because I paid mine anyway, but I didn't want to pay them for months.
But I just saw somewhere, and I have not confirmed it yet, but now ICE is going after the Vietnamese refugees who came over after the Vietnamese War, so have been here for 50 years.
Oh,
Now they're going after them. So
what did they do wrong?
they don't look like you and I.
I mean, that's basically
That's
it.
basically it.
Because those people do have, they're not troublemakers. You don't see them.
Wouldn't it be nice if they made like those big Winnebagos that were hybrids?
Yeah, I don't know if they have that yet.
I doubt it, and especially because he put the solar panels on top. Probably not.
It's
Did I forget to trim this one last time?
I don't know.
Hasn't been bothering you though?
Mhm.
Okay. Well, that's the name of the game, is to get it so they don't bother you.
No, my feet have felt wonderful for ages now.
Good. That's our goal. Keep you walking as much as you can.
Yeah, I walk every day. I mean, I have to actually because my apartment is way at the end of a corridor, so every time I go down to do anything, it's a long walk.
Did you do that by design? Did you pick that apartment?
No, I didn't even think of it at the time.
Ah.
I just liked the apartment. Everybody just thought that was the nicest apartment because it had windows on two sides and it was bright. And
Means we're recording. So, in Miami, unfortunately, I don't think I know anybody who practices right in Miami.
Yeah, I hate to go to anybody in Miami. I've had such bad luck.
Okay. I mean, and so if you're, when you come in between your journeys, You know, when you know you're going to be back, call and schedule an appointment to get all this stuff taken care of.
That's what happens to me. I was gone a lot, but when I called, you didn't have anything, because I called kind of late.
Okay, so we always keep a cancellation list, and we always get cancellations.
I gotta remember that, because
Yeah, so ask to be put on the cancellation list. If you're in a lot of pain, you can always leave me a message, and I can oftentimes come in early the next day and see you, or maybe over a lunch hour or something. If you're in significant pain like today with this one,
yeah, this is bad.
yeah, I wish I had videoed from the minute I started this one. But so you've got this, and there's a corresponding one over here that get thick, so I already trimmed it. All right, so that should make you feel a lot better.
No, we're talking.
We don't,
Well, we can talk.
Yeah, just not that, yeah.
Yeah.
I don't either.
So what hospital did they have you in for a week?
Do you remember? It's the closest one to her up in the, up on that area.
Okay.
And then,
And they probably got you diagnosed right away.
They did.
They did.
Yes,
It was
yeah.
my daughter, we stopped to see and he's been very sick. And,
Did they give you the room right next to him?
One
No,
look.
they were different.
No, they took
Oh.
one look at me in
The
the
I,
nursery room, and I was
In
in
the-
the
in
hospital
the nurse-
before I knew it.
yeah, yeah.
And I had this bad stuff going on in my,
Your kidneys and,
yeah.
yeah.
But no, they were at two different hospitals, so we were doing the
Yeah.
north end and the south end,
Oh.
visiting. You know, one
Yeah.
of us, we have a few nurses in the family, so it was okay. We had one nurse more down there and another, me up here, and so it was like, it was crazy couple weeks. But we made it through. They're both out now, and,
Oh, good.
yeah. And Mom's certainly getting better, aren't you, Mom?
That's the stuff.
Yeah, well, your calluses there, that's
Yeah.
pretty normal for you.
Yeah, it is, it really is, you're right.
Trying to get you to walk a little better now that you're out of the hospital and pick your feet up. Not that that probably makes a difference on the calluses. But
It does. The more you're off of them, the less callus you're gonna
Yeah.
have, but you're coming here for the calluses, so I would rather see big calluses so I know you're walking.
absolutely.
Okay.
Yeah. I know, Mom, there's a lot of people that go to get their feet done, you know, and have the what do you call it?
Pedicures.
Pedicure, thank you. And then,
You're fine. It's just the vibration from the machine.